Hello, I'm Alisa Burke, Physical Activity Lead at Pennybrawn UK. So today I wanted to talk about the importance of being active whilst on active cancer treatment. So for years now, we're starting to hear more and more oncology departments, cancer charities, physios talk about exercise as being medicine. Exercise medicine, movement medicine. Macmillan in 2016 referred to physical activity as the underrated wonder drug. Professor Corrie described it as if we could bottle it up as a medicine, we would be prescribing it. Some researchers have started more recently to look at different types of exercise, and particularly muscle strength exercises, what we call resistance training, has been described by researchers as the most potent non-pharmacological intervention for cancer patients. So how much exercise should we be doing whilst on treatment? Firstly, I should say it's really important you do talk to your doctors. It's very individual. Everyone's treatment's different and our experience of treatment will really vary. Our fitness base, our genetics, our age, and so forth will really make a difference to what exercise is suitable and when, what you enjoy and what is feasible and what might fit into your week. But being active, however, is a way of taking back control during this time of uncertainty while you're undergoing treatment. It's a way of reconnecting with the body positively, gives a structure to your week, and can be a really great way to reduce stress. It doesn't have to be in large amounts, as we're going to talk about. It may be very small doses or very gentle exercise, but can still really help to really improve your outcomes from your cancer treatment. So the main way that being active can really help you is to really counter what we call deconditioning that will happen to most of us as we go through surgery and or treatment. So deconditioning just means that during that time where we are becoming more sedentary, while we go through our recuperation, that we start to lose muscle mass, we might lose some flexibility, and we lose some heart and lung function and fitness. Potentially also some of the medications that we're on may also have some impact on our heart function, or and also create quite significant side effects for some of us, which can make us feel pretty lousy and really not like moving. But actually research shows if you can just make an effort to put one foot in front of the other, or maybe just doing some upper body exercises from your chair or bed, any sort of movement can actually help reduce those side effects and really improve how you feel and improve your functional fitness and your quality of life. So what does the evidence show? So there's a really expanding evidence base over the last 10 years. And this is why really people are waking up now to seeing exercise as a really almost essential intervention at any stage along the cancer pathway. The most promising evidence is showing that movement can really help with cancer-related fatigue. So the fatigue we get from having the cancer, from some of the treatments like chemotherapy. Even though it may feel like the last thing you feel like doing, if you can try and keep active, whether it's a short walk, a little bit of gentle movement, or maybe you're going to feel up to joining some classes or keeping up with some of your existing exercise routine before treatment, then it can really help reduce that feeling of fatigue and the brain fog. There is also strong evidence that exercise on treatment can really help hold on to that healthy body composition, so retaining the muscle mass and reducing the body fat percentage. It can help with your mental well-being. So say meeting the government guidelines, which we'll come to for exercise or activity, can help reduce the risk of depression by about 30%. It's believed that moving really helps release chemicals called endorphins and others called endocannabinoids and maybe some dopamine. They're all hormones or chemicals that can make us feel much more positive and happy and able to perhaps complete our treatment and stay more in control. There's moderate evidence that being active whilst on treatment can really help reduce cancer recurrence risk and extend life expectancy. Cancer aside, there's also great evidence to show that for all causes of mortality, you're going to get some really big reductions if you can try and maintain some fairly regular, moderate intensity activity. There's some interesting, more recent research showing that being active, because of the contraction and relaxation repeatedly of your muscles, produces these very helpful chemicals, we call them myokines, that stimulate your immune system to produce more T cells and natural killer cells, which are our defenders of our immune system, that again, what you want as many of as you can when you're fighting something like a cancer diagnosis. There's also some preliminary evidence that exercise can actually help with pain, with insomnia. It can help reduce anxiety, and especially if we exercise with others, it can reduce social isolation. There's also some interesting studies going on looking at exercising right in those few hours before your chemotherapy treatment. Perhaps it's through oxygenating the cells, but it really seems to help improve the efficacy of your treatment, as well as maybe reduce the side effects. Some research by someone called Gong and others showed that following a healthy lifestyle, so being active as well as good nutrition, led to a 40% better response to immunotherapy. There are also many other biological pathways that people are looking at of why movement is so effective in producing these better outcomes. So when we consider how much exercise to do and what's suitable for you, if we put it in the context of also your age and the natural aging process, it's not all about the cancer diagnosis. As we probably have our most muscle mass and bone density when we hit around the age of 30. After that, naturally, we will have a decline in our muscle mass and our bone density unless we really do work hard to do something about it. And that decline in muscle mass and bone density will really accelerate when we hit menopause, whether it's naturally or chemically induced, or through a hysterectomy, for example, or just because we age. When we get to 60 or 70, we can lose up to about 3% of our muscle mass a year. So it's really important to try and do something to counter the deconditioning that would happen anyway as we age. But perhaps on top of that, then we have some deconditioning due to the treatment you're going through, or the medicines you're on, or the surgery you're having to have, causing periods of inactivity. So it's just finding ways that can counter these effects. So it's doing something to try and maintain your fitness. That could be trying to build up a little bit of walking, if you're someone that likes cycling or swimming or dancing. Any sort of repetitive movement we would consider aerobic or cardiovascular movement. And that really helps strengthen the heart and the lungs, especially when some of the chemotherapy drugs can have a detrimental effect on your heart health. So it's building up in little steps to do some cardiovascular activity, trying to find some ways to do some muscle strength exercises. And this really could be anything from sweeping the leaves, carrying the garden waste to the bonfire, carrying heavy shopping bags, doing some exercises with weights, maybe marching up a steep hill. It could be swimming with hand paddles, so you're really getting some resistance through the water. Really something that's going to give your muscles something to work against. And that type of activity is also great for maintaining your bone density, again, which may be impacted by some of the drugs that you're on. So bone strength can come from a compressive force, which we get when we're working against resistance, like exercise bands, weights, carrying things. And it also can improve you can improve your bone density through some impact work, like when we're walking, maybe going hill walking, anything, like walking down a hill, you get even a bit more gravity. So that sort of low to medium impact work should be safe for most of us and will really help maintain that bone density. So the third form, we've got our cardiovascular, our muscle strength. The third form of exercise is doing something for your flexibility. So trying to do some stretches every day, maybe some lovely movement like Tai Chi or Qigong, just really opening up the body, especially the muscles down the front of the body, maybe doing a daily stretch, joining a stretch class, doing some gentle yoga would all be ways to sort of tick that third box so that we've really got all of our bases covered to counter that deconditioning and get us the results we want. I thought I'd just go over some of the questions I commonly get asked about in our treatment support clinics here at Penny Brawn, about things that people are concerned about in getting back to being active again. In fact, the studies show that in the UK, only about 36% of men and 18% of women actually hit the recommended amount of weekly activity. And for those that don't know, that amount is the same as the government guidelines or the NHS guidelines and also international guidelines. We're looking to do about 150 minutes of moderate activity a week and something twice a week for muscle strength. And if you're over 65, to also add in some work for balance. So basically trying to be active every day. If those sort of amounts of exercise just feel very unachievable where you're at right now, that's fine. The studies showed that first 5 minutes of exercise is where you get the most gains. So if everyone did 20 minutes of exercise done really well a week, you're actually going to be about 70% along the way of getting those gains from exercise. So it's really front loaded. So at least trying to do a little bit every week and then just trying to build up from there towards those government guidelines is absolutely fine. So go with where you're at. So some of those safety tips, really make sure that what you're doing is tailored to you. Don't worry what anyone else is doing. Build up at your own rate, build up gradually. And if you do have any of what we call red flags, so any unexpected symptoms, any pain, unexpected bleeding, dizziness, your blood platelet count's been too low for chemo, for example, we wouldn't be wanting to exercise, and just check it out with your doctor before restarting to exercise. If you've got osteoarthritis, it is fine to exercise. You might want to make sure you exercise a bit later on in the day once the joints have warmed up. Maybe avoid exercising on days that the joints are very inflamed, and do avoid very high impact activity. So you'd be more suited, perhaps more frequent but shorter sessions, so not big endurance sessions, because we don't want that joint wear and tear, and exercising perhaps in the afternoon or evening. Peripheral neuropathy and lymphedema are side effects some people will get from treatment. Neither of them are reasons not to exercise, and in fact research is showing it's safe to exercise with those conditions. Do wear a compression garment if you've got lymphedema, especially in an acute phase where it's quite swollen. And if it is swollen, we wouldn't be using the weights, but we would want you to keep working on your range of movement. It's really important. And that movement can really help pump that lymph along and actually help reduce the lymphedema over time, or help prevent getting lymphedema in the first place. There's plenty of places you can get some extra support or advice if needed. So do check out with your hospital physio team what might be available for some extra support if it's needed. Here at Penny Brawn, I'm very happy to offer some one-to-one sessions with you for advice and support, and you're welcome to book those through our bookings team by email or giving them a call. We also run plenty of classes online at the moment, and you can see those on the Penny Brawn UK website, looking at our online group sessions page. The NHS has some great resources online. If you look up NHS Fitness Studio, you'll see things from Vinyasa yoga to beginner's belly dancing. The people that make those resistance bands, one company is called Meglio. mymeglio.com is the website, and if you go onto their hub, there is also some great videos for exercises with resistance bands that you could do at home. There's things like the Safe Fit trial. It's a nationwide scheme you could join for anyone who has got a cancer diagnosis, where you get one-to-one support. Macmillan have some great information resources. And in your local area, you could find things like Walking for Health, which is a great nationwide scheme. You've got GP exercise referral schemes you could talk to your GP about and get some help, especially if you have any other medical conditions and want some specialist advice for exercise. And lastly, there's in your local area, in the southwest, for example, where I am, we have things called Energize in Bristol, who run classes once you've completed your treatment. And we have the Link Age Network for the over 55s that do all sorts of classes, walking groups, dance, and so forth. So there's plenty of things around. Do get in touch if you'd like some more advice, but try and stay active while you're on treatment as best you can. And maybe I'll be seeing you on one of my classes. But thanks for listening today.